Hi everyone, Andrea and Ernie here. We've just launched a new video podcast on YouTube called
Paediatric First Aid.
You know, when a child is in distress, that first instinct for most of us is just panic, right? But what if you could trade that panic for a clear, confident plan? That's what we're going to talk about. We're breaking down the absolute essentials of pediatric first aid using the kind of practical, no-nonsense wisdom you'd get from someone with decades of frontline experience. The goal here isn't just to learn the steps, it's to build that real confidence so you can act when it really truly matters. So let's dive in.
Okay, picture it. A child suddenly needs your help. What is the very first thing you do? Those first few seconds can change absolutely everything. And you might be surprised to hear that the most important first step happens before you even get to the child. A seasoned pro calls this the doorway assessment. It's about sizing up the entire situation the second you walk into the room.
So let's get really clear on what our role is here. We're talking about immediate care. This isn't about becoming a paramedic overnight. It's about being that crucial link, that bridge to professional medical help. You are literally the first link in the chain of survival, and doing the right things in those first few minutes can preserve life and stop things from getting any worse.
And that brings us to the very first rule. And honestly, it can feel a little backwards. Before you rush over to that child, your number one priority is making sure the scene is safe. Think about it. You can't help anyone if you become a patient yourself. This is the whole foundation of that doorway assessment.
A really brilliant way to remember this is the CLAP acronym. So C is for control. Take a deep breath and get control of yourself first. L is for look. Scan the area for any hazards. Is there spilled water, traffic, anything that could cause more harm? A is for assess. Get a quick idea of what might have happened. And P is for protect and prioritize. Protect yourself, maybe with gloves if you have them. And if there's more than one child, figure out who needs help the most urgently. All right, once you know the scene is safe, your focus can shift 100% to the child. Now we need a quick, systematic way to check for any immediate, life-threatening problems. This is what we call the primary survey. The key word here is systematic. You know, when your adrenaline is pumping, you don't rise to the occasion, you fall back on your training. This system is your checklist. It's a framework that keeps you focused and makes sure you don't miss anything critical when the pressure is on. And here is that system, D-R-B-C-D. D is for danger. We've already covered that with our scene survey. R is for response. You're going to gently tap the child's shoulder and ask loudly, "Are you all right?" A is for airway. If they're not responding, you need to open their airway. Just gently tilt their head back and lift their chin. B is for breathing. Put your cheek near their mouth and look, listen, and feel for normal breathing. Don't take more than 10 seconds for this. We'll get to C for circulation and D for defibrillation in just a minute.
So what if you've checked and they are unresponsive, but they are breathing normally? This next step is absolutely vital. You've got to get them into the recovery position. This simple move protects their airway and stops them from choking. It's the safe, default position for any unconscious person who is breathing.
And it's actually a really simple, logical process. You take the arm that's closest to you and place it out at a right angle. Bring their other hand up against their cheek. Then bend their knee that's furthest away from you. Now, using that bent knee as a lever, you just gently roll them towards you, right onto their side. This keeps them stable, and most importantly, keeps that airway open.
Okay, now we're moving into the situations that need immediate, hands-on intervention. This is what you do when a child isn't breathing or when their airway is completely blocked and they're choking.
CPR. We've all heard the term, but let's really think about what we're doing. You are literally taking over the job of the heart and the lungs. You become their life support system, pushing oxygenated blood around their body to keep the brain and other vital organs alive until professional help can take over.
Now here is one of the biggest differences in pediatric CPR, and it's a huge one. Unlike with adults, you always start with 5 initial rescue breaths before you even think about chest compressions. This is so important because in children, cardiac arrest is very often caused by a breathing problem, like choking or drowning. So getting that oxygen in first is your top priority.
After those first 5 breaths, you get into a steady rhythm. 30 chest compressions, then 2 rescue breaths. 30 to 2, 30 to 2. A great practical pearl here? For a child, you'll use 1 or 2 hands and press down about 1/3 of the depth of their chest. But for an infant, you just use 2 fingers. And the speed is so important. You're aiming for a rate of 100 to 120 compressions every minute. You know the best way to keep time?
press to the beat of the song Stayin' Alive by the Bee Gees. I know it sounds a bit strange, but trust me, it works, and it's something you can easily remember when you're under pressure.
All right, let's talk about choking. It is so important to know the difference between mild and severe. If a child is coughing, if they're making noise, that's actually a good sign. It's mild. Their own cough is the best tool they have, so just encourage them to keep coughing. But severe choking, that's silent. They can't breathe, they can't make a sound. This is a real emergency, and you have to act immediately.
So for severe choking, the protocol is very clear. Get the child to lean forward so gravity can help you out. Give up to 5 really sharp back blows, right between their shoulder blades. If that doesn't work, give up to 5 abdominal thrusts. And you just keep going in that cycle. 5 back blows, 5 thrusts, until that object comes out or until the child becomes unresponsive.
Okay, so beyond breathing emergencies, there are a couple of other common situations that really need a calm, fast response. Let's quickly cover how to manage severe bleeding and a severe allergic reaction, which is known as anaphylaxis. With severe bleeding, the #1 goal is to stop the blood from leaving the body. It's that simple. If you can, put on some gloves. Then grab a sterile dressing or even just a clean cloth and apply firm, direct pressure right onto the wound. If blood soaks through that first pad, do not take it off. Just add another one right on top and keep that firm pressure on. Now, anaphylaxis is a very rapid and severe allergic reaction that affects the whole body. The common triggers are things you might expect, foods like peanuts and shellfish, insect stings, certain medications, and sometimes even latex. The signs can come on scarily fast. You're looking for swelling, especially around the face, mouth, and tongue, difficulty breathing or wheezing, and often a big skin reaction like hives. If you know a child has an allergy and they carry an adrenaline autoinjector, you need to be ready to use it right away and call for an ambulance. All right, so the immediate emergency is handled and help is on the way, but your job isn't quite done yet. Especially for those of you working in a professional setting like a nursery or a school, there is one final, really important step: recording what happened. Proper documentation is absolutely essential. You need to record the who, what, where, and when, and exactly what actions you took. And this isn't just about paperwork, it's vital for communicating with parents and, really importantly, for helping to spot any trends that can make the environment safer for all the kids in the future. And that really brings us to the most important point of all. Watching this is a fantastic start, but first aid is a practical skill. It's something you have to do. This is the whole philosophy behind hands-on training, like the courses run at places like the Bolton Under Fives Forum. It's all about developing competency, that true confidence that only comes from practice. So, we've just done a complete kit check of your knowledge for children from 0 to 11. Remember those practical pearls. Always start with that doorway assessment. Use your systems like DRABCD, and always protect the airway. This knowledge is your map to get through the chaos. So the final question is really for you. Are you ready to be the calm in the storm? Thanks for joining us.